of Health and Harm Reduction with the Cattell Center for Health, Equity, and Justice. Thank you for having me. You have my testimony in front of you, so I'm just hoping to expound on some of these points here a little bit. So I first want to say that we have to be really deliberate about talking differently about what we're in right now. I've heard the term opioid epidemic brought up several times, opioid crisis brought up a few times. We are not in an opioid crisis. We're in a crisis of what the CDC has called deaths of despair. Opioid deaths and other drug fatalities are the symptom, not the disease. And I want to be really clear about this because this is really important about how we address this moving forward, because we can't keep playing a whack-a-mole game with substances when that's not actually the issue. Yes, obviously opioids have been contributing towards overdose deaths, but most overdose deaths are actually polysubstance use related. People are dying of cocaine overdoses. People are dying of methamphetamine overdoses. People are dying from alcohol. Our drug supply is poisoned, right, by benzodiazepines, fentanyl, right? We have to be really clear that this is a crisis of housing, of inadequate housing. It's a crisis of income inequality. This is why they say that these are deaths of despair. This is a crisis of health care. People do not have adequate health care. So I say this because when we call this an opioid crisis or an opioid epidemic, it leaves certain people out of the equation when we talk about it that way. I'm sure you're going to hear about racial equity from I'm incredibly grateful to be on this panel with these two strong black women who are going to tell you exactly what's up after this. But we're leaving people out of this conversation. We're leaving people out of this thing. And the narrative has been that white folks in the suburbs are dying, and now we got to do something about this. And we need to be really clear that these are the chickens coming home to roost from the drug war that's been largely impacting black and brown people and poor people since it was started. And we have to name that it's now only because white kids from the suburbs started dying that folks are saying we have to take a different approach to this thing. We should have done it then. We have to do it now. Otherwise, there's going to be another round of substances that people are dying from, and we're going to be ill-equipped to handle it. We have to invest in the things that we know work right now. And I would be remiss if I didn't mention that most people who actually start their use on a prescription opioid, it has not been prescribed to them. This is really clear. To say that we have to crack down on prescription opioids at this point in the crisis is ridiculous. That ship sailed. And what is happening, though, is people with intractable chronic pain are being force tapered or cut off from their medications. They're turning to the illicit market that we know is poisoned with fentanyl, and they're dying of overdoses because they can't get their pain managed. Some of these folks are even committing suicide from pain. So we can't leave them out of the equation either. So I just want to name that. That is really misguided to actually focus on that, right? Just to be clear, those were not medications prescribed to those folks. That's what the data shows overwhelmingly. So what we have to do practically, I've been working with people who use drugs for my entire career. I've lost people close to me. I have family members, right, who struggle with addiction. I started my career in HIV. I saw how racial disparities and other disparities impacted that population of folks, right? And I'm tired of this, and the answer is actually staring us right in the face. That's right. You cannot treat substance use as a health issue under the specter of criminalization and prohibition. You cannot do it. We have to decriminalize use and possession of all substances, and we need to divest from law enforcement, incarceration, and all those other tools. And we can invest in health, we can invest in housing, we can invest in the things that we know work, because this is a very important point. Regardless of the fact that there are people who believe so, increased penalties and increased enforcement does not actually lead to reductions in drug use, reductions in drug-related deaths, or reductions in crime. It doesn't actually work. We've just been led to believe that it does work. And I would challenge us as New Yorkers to be the New Yorkers we have a reputation for being. And we need to bootstrap each other. We need to protect our family, our friends, our community members. And we need to be the ones showing the rest of the country that we can do this thing different. In the meantime, here are the things I would really encourage you to do. Decriminalize possession of syringes now, right now. Put significant investments into harm reduction programs, at least at the level that you're doing so with treatment. period. Fund the AIDS Institute. I know it's weird, but that's where the Office of Drug User Health lies. Those folks need money. They've actually been experiencing cuts. We can't do that. There needs to be a separate line for naloxone funding so those state agencies don't have to take it out of their budget. We need to authorize overdose prevention centers 10 years ago. Not this year, not last year, 10 years ago. It's ridiculous that we don't have them. I'm sorry, I'm wrapping up. Low threshold medication treatment in all settings, including in corrections. The fact that that bill didn't pass last year is really, really just unconscionable. We need to do less is more and reform our parole system now. Now. Locking people up for parole violations for substance use is not appropriate. Decriminalize sex work now. Repeal the ban, the walking while trans ban for our trans brothers and sisters. No more solitary confinement, pass halt solitary this year. And do not yield an inch on bail reform, please.
Thank you, sir.
And listen to people who use drugs.
Thank you, sir. Go ahead, ma'am.
Good morning. My name is Lauren Manning. I'm the Assistant Director at the Center for Law and Justice.